proceed with the discussion, but may I ask the Honorable Remulla, as regards to the disposition of this investigation, ano po ba ang kahalagahan ng investigasyon natin na alam naman po natin kahapon nagkaroon ng hearing at Senado at patuloy na rin po na nagkakaroon ng hearing ang ating eksekutibo. So may recognize the Honorable Remulla.
Thank you, Mr. Chairman. Good morning. Marami hong nagtatanong kung bakit kailangan pa ng House of Representatives na mag-imbestiga ng Philhealth, gayon naman na andun na ang Senado at andun na ang DOJ na nag-iimbestiga ng mga problema ng Philhealth. Ngayon, ang humaharap po sa inyo ngayon ay dalawang komite. Ang Committee on Public Accounts na tinitingnan niya po ang pananalapi ng ating bayan at ang mga pananalapi na kinakailangan bantayan sapagkat ito po yung nangyagaling sa taong bayan. At ang pangalawa pong committee na hinaharap nyo ngayon ay ang Committee on Good Government and Public Accountability na siya ring House Blue Ribbon Committee. May investigasyon na nga ang DOJ, maaari pong mag-imbestiga rin ang Ombudsman, maaari pong ituloy-tuloy ng COA ang kanyang pag-audit, ngunit mahalaga sa process po ng paggawa ng batas. Pag tayo po ay gumagawa ng batas, ay ang investigasyon po ay mahalaga. Dalawa po ang sangay ng ating Legislative Department. Meron po tayong Senado at meron po tayong House of Representatives. At ang perspective po na nanggagaling sa Senado ay kakaiba sa perspective na nanggagaling sa House of Representatives. At alam natin, sa bicameral legislature, kinakailangan po magkasundo pareho ang House at Senate para magkaroon ng batas na kalalabasan ang kahit na anong investigasyon. Kaya hindi po ito superfluity, hindi po ito sobra-sobrang nagpapatong-patong na investigasyon sapagkat iba-ibang perspektibo po nanggagaling ang mga tanong namin. Ang abiso lang namin sa aming mga miyembro ay panoorin din po ang Senate hearings at panoorin at alamin din ang ginagawa ng DOJ para alam natin ang lahat ng kinikilos ng lahat ng ahensya nang maging kumpleto ang pagtingin sa lahat ng mga bagay-bagay na maaaring sumambulat sa lahat ng mga investigasyon. Kaya kung tatanungin po kung bakit sabay-sabay nag-iimbestiga ang at ibang sangay ng gobyerno, marahil ang pinakamagandang sagot dito, ang bawat Pilipino ay miyembro ng Philhealth. At dapat lang na ang lahat na maaari magbantay sa kaban ng bayan ay magbantay na at magtanong ng mga kinakailangan itanong upang matapos ang mga alinlangan natin sa ating Philhealth. Kasi marami hong lumabas na hindi ka nais-nais na balita na ngayon dapat po magkaroon tayo ng closure at magkaroon po tayo ng solusyon para sa kinabukasan ng Philhealth at sa kinabukasan ng ating health policy sa Republika ng Pilipinas. Yun po ang dahilan kung bakit ang iba't ibang sangay ng gobyerno ay maaari pong mag-imbestiga nang hindi naman nagpapatong, kahit na sinasabi nagpapatong-patong, ay iba-iba ang pinanggagalingan naming lahat. Yun lang po, Mr. Chairman.
Maraming salamat, Senior Vice Chairman, our Senior Deputy Majority Floor Leader, Congressman Boying Remulla. The Honorable Fernandez, like to be
Mr. Chairman, thank you so much, and I totally agree with Congressman Remulla, and at the same time, I agree with the Chair that we categorize the different issues that we're going to tackle today, precisely because mahirap pong pagsama-samahin yung mga issues, and by doing this, we will be able to tackle each and every issue with certainty. With that, Mr. Chairman, ay sana po ay pakinggan din po natin yung mga presentation ng ating mga resource speakers for today. Kailangan po, Mr. Chairman.
Thank you.
Mr. Chairman.
Yes, Honorable Remulla.
Yes, Mr. Chairman, meron lang ako bago tayo magsimula sa iba't ibang mga katanungan na lalabas po sa investigasyon na ito. Nais ko lang po linawin muna yung isang bagay na buhabagabag sa akin. Andito ho si Nerissa Santiago, Senior Vice President. Kayo po ay naglabas ng isang statement na sabi nyo ang actuarial life ng Philhealth ay maaari 1 taon na lang lamang Pwede ba kong pakilinaw ito at ipaliwanag sa amin kung bakit niyo po nasabi ito sapagkat ito po yung nakakagambala at maaari pong matapos po ang usapin na ito bago tayo magsimula.
Go ahead, Phil is recognized.
Thank you. Good morning, Mr. House Speaker and the rest of the honorable members of the House. Regarding po dun sa 1 year na lang po, at actually it's based on assumptions po, projections. That means tinitingnan po natin kung ano po yung probable na papasok na pera at ilalabas natin na pera. So for this year, we have an actual figures as of June na mapagbabasehan po natin ng actual na pumasok na pera, although yung benefits hindi pa rin po actual kasi we have given the hospitals 120 days to submit their claims instead of the usual 60 days po. So kung halimbawa po na ospital ng Marso, mabibigay pa po yan 4 months after. Meron po silang 4 months to submit yung claims. Kaya po hindi po ganun kadami yung aming basis for the benefit payouts. So yun po, bali yung projection po na 1 year is yung papasok po na pera, so yun po yung collection na manggagaling sa indirect, which is the subsidy coming from the government for the premiums of the indirect contributors, and yun pong sa direct contributors na collection na manggagaling po sa kanila. So dalawa po yung panggagalingan natin. So for 2020 po, nakita po namin na for April, May, June, bumaba po ang ating collection because of the slowdown of the economy. So, yun po yung pinagbasihan natin for the rest of the year, average po nung marireceive natin. So, for the direct muna po, we expect na yung sa government, we will still get what, as an employer, we will still get yung kasi hindi naman po sila, kumbaga, ang gobyerno naman po, tuloy-tuloy po ang bayad. So on the employed, private employed sector, ito po yung merong mga nagsara, may mga na-lay off, may mga na-retrench at hindi na makatrabaho. So yun po yung dahilan kung bakit bababa. Yung po sa informal naman po, ito naman po yung individually paying. So, kung makakabayad po sila, magbabayad sila. So kung wala po silang trabaho, hindi po sila magbabayad. So basically, yung pong pasok ng pera, bumaba po for 2020. And for the benefit payout naman po, yung paglabas ng pera for 2020, because of the COVID pandemic, we expect a higher benefit payout. Kasama po dito yung COVID inpatient at saka COVID testing. So, dahil po dalawa po yung side na naapektuhan, bumaba ang collection at tumaas ang benefit payout for 2020, kakain po to sa reserve fund. Ibig sabihin, may deficit po tayo between benefits and collection. Mas mataas po yung benefit payouts natin kaysa sa collection.
Ignacio, Honorable Remulla,
Ay,
if
sir.
you recall, dun sa pag-usap natin, kung papayag po kayo, we go to the all case rate,
Okay.
and then we proceed to IRM, and then ito pong finance that you're asking now.
Itutuloy ko sa case rate na pagkatapos. Nasa next question ko sa case rate na po.
Okay.
Pwede.
Okay. Just so the members are clarified, Honorable Remulla, after you, the Honorable Sarate, Barbers, Marcoleta, and Kimbo will be doing their interpellation. Go ahead, continue.
Tuloy niyo po yung sagot niyo. Tapos,
Pagdating po sa 2021, dahil po meron po tayong recession in 2020, na-expect po natin na even in 2021, bababa po yung ating collection. So may in-expect po kami. Ang inassume po namin doon is a decrease of about 25% in the direct 25% decrease in terms of direct contributors. Pagdating po sa indirect, we have proposed to DBM na 138 po sana, 138 billion ang i-allot sa amin sa GAA for 2021. Kaya lang po na we got advice na they will, only give us 71 billion na pareho po siya nitong 2020. So, in that aspect po, mababa po yung makukuha natin na collection in 2021.
So, Mr. Tiago, you're a practicing actuary.
Apo.
So, you're a math major.
Yes.
Math talaga ang ano niyo.
Yes po.
So, pagdating po rito, so let's go to the case rates, no, Mr. Chairman. So, if I may begin. How many cases does Philhealth recognize all case rates? Anybody? Mr. Pargas?
Mr. Chair, go ahead. Mr. Congressman, yes, sir. We have around more than 4,000 cases for the medical illnesses, and for the surgical procedures, we have more than 4,000 case rates also, sir.
You mean 4,000 types of case rates?
Yes, sir.
Ano ho ang pinakamaraming case rate na binabayaran ng all case rate na binabayaran ng PhilHealth sa ngayon? Give me the top 5 or top 6 case rates, all case rates that PhilHealth has paid.
Mr. Chairman, if I may, point of order. Did we, yes, go ahead. I move that we take the oath of all the resource speakers
Oath muna.
for today's hearing.
Thank you for that, Honorable Fernandez. With the indulgence of our guests, those who are here and those in Zoom, may we request you to take your oath before we continue with our interpellation. The committee secretary is directed, the Honorable Comsec Marivic, kindly swear in our guest. So ordered.
Please stand and raise your right hand. This also applied to those resource person participating via Zoom. Do you swear to tell the truth, the whole truth, and nothing but the truth before this hearing? So help you God? Thank you.
Maraming pong salamat. Honorable Rimulya, kindly continue. The reply on the question of the Honorable Rimulya.
Yes, ano yung 6 na pinakamatataas na ano yung 7 na pinakamatataas na binabayaran ng PhilHealth sa all case rate and corresponding amount for the year 2018? Para may sample lang ho tayo sa isang taon.
Mr. Chair, Mr. Congressman, sir, the data I have here is for 2019. If
O
it's,
sige, 2019.
for the medical case rates by claims count po, the number 1 is community-acquired pneumonia. Number 2 is dengue. Number 3 is, this is the dengue hemorrhagic fever with warning signs. The number 3 is UTI. The number 4 is acute gastroenteritis. The number 5 is still dengue without the warning signs. This is the dengue one. Then we have the bacterial sepsis of the newborn unspecified. Then number 7 is bronchial asthma in acute exacerbation. Number 8 is hypertension, stage 2. Number 1 is essential hypertension, and the last is acute gastroenteritis. For the procedures, by claims count, it is hemodialysis. Number 2 is obstetric care. This is the normal spontaneous delivery. The newborn care package. Then the expanded newborn care package, we have the routine obstetric, which is in the non-hospital facility. Cesarean delivery primary, the vaginal delivery with episiotomy. Then the chemotherapy, cesarean, and then the cataract as number 10. For the amount, sir, for 2019, the dialysis procedure is around 10 billion. The obstetric normal spontaneous delivery in hospitals is 2.4 billion. The newborn care package is around 722 million. The expanded newborn is at 1.1 billion. Those in the maternity care package at 2.3, this is in the non-hospital facility. Cesarean for primary is 3.5. Vaginal delivery only at 1.3, then chemo at 943, cesarean delivery at 2.2, and for the cataract removal, it's 1.6 billion. For
Dr.
pneumonia,
Pargas, sandali, Dr. Pargas. Sa lahat ng ito, nagwi-withhold ba ang Philhealth ng taxes para sa mga doctor's fees?
Ang ating pong withholding tax ay naka-charge po sa hospitals at ang sa professional fee naman po, ang mga hospitals po ang nag-deduct ng withholding tax. Because the case rate as it is provided and paid to the hospital as a whole package po. It is the hospital who brings or who gives the payment to the professionals.
So, pagdating po sa sabihin natin, no? Pneumonia, maraming klaseng pneumonia po, di ba? May moderate, merong mild, tsaka merong severe. Tama ba ho yan?
Yes po.
Ang inyong mild pneumonia, 44,000 ang package.
Mr. President, Mr. Chair, Mr. Congressman, yun pong sa mild, moderate, and pneumonia, mild, moderate, severe, and critical is for the COVID packages. But prior to the COVID, we have two for the pneumonia. The pneumonia for moderate risk and the pneumonia for the severe. The mild pneumonia as considered prior to the COVID is not being paid as an inpatient. Rather, it is part of our primary care benefit package.
So, magkano yun? Magkano ang all-case rate nyo sa mild pneumonia? 44,000?
Well, before the COVID po, wala po tayong case rate for the mild pneumonia. It is being paid or part of the primary care benefit or the
Dr. Vargas,
outpatient.
you have two. The acquired pneumonia, which is 15,000, at saka yung
Severe po.
severe pneumonia, which is 32,000.
Yes, that is prior to COVID po. Nung lumabas po yung COVID, because the main condition then being attributed to the COVID as part of the presentation is the pneumonia. So yun pong naging package for the COVID with mild pneumonia po is at 43,000. Yun naman pong for the moderate is at 130 plus thousand. Yun pong for the severe, it's at around 300 plus, and yun pong sa critical is around 700 plus thousand.
How did you arrive at these amounts, Dr. Vargas? Or Dr. Vargas?
When the pneumonia, when the COVID started, Mr. President, Mr. Congressman, when the pneumonia, when the COVID started po, there were no standard. There were no clinical guidelines then because the guidelines po are developing and every day the signs and symptoms are changing. So what we did po to come up with the packages for the COVID pneumonia is we asked from the data from the itemized billing charges from the hospitals who already had pneumonia cases then because we don't have any experience on the COVID. Then we had based our management or treatment guidelines with those which are being established by the PISMID or the Philippine Society of Microbiology and Infectious Diseases and all the protocols that are coming out with the DOH. So technically the input po for the prices or the costs as we costed it are coming from the itemized billing charges of the
So ano
hospital.
yung i-itemize nyo nga sa amin kung paano dumating ang 44,000, paano ho dumating sa 44,000 yan? Magkano ang fees, magkano po ang gamot, magkano po ang kwarto, magkano po ano po yung breakdown yan, 44,000?
Honorable Remulla, while the Philhealth is preparing the presentation on how they arrive, kung paano nila nakuha yung bawat presyo dito sa COVID, meron sana akong presentation on the ECR. Pero madami-dami siyang slides. Pero these are all official slides. If you want, I'll present it and then
Let's finish this question, Mr. Chairman.
Dr. Vargas.
Yes, Mr. President, Mr. Congressman, yes, sir. We had a third party, the Palladium of the USAID, who actually helped us with the coming out of the packages. This would include, again, the accommodation, the drugs and medicines, the supplies, the PPEs, and the diagnostics, which are then costed, and the amounts or almost the median range of these cases came out as as the package 43,000.
Same rate ba yan, Dr. Vargas? Same rate ba yan sa public hospital at sa
Yes.
private hospital?
Yes, Mr. President, Mr. Congressman, yes po. We have the same amount for public and of course the private hospitals. Yes, sir.
So sa all case rate, Mr. Vargas, ilang percent ang binabayad ng Philhealth comparatively sa private sector, sa public hospitals, at ilang percent ang binabayad sa private hospitals? Anybody from Philhealth, baka may sagot na kayong ready dyan. Ilang percent nagpupunta sa private hospital, ilang percent nagpupunta sa public hospital?
Mr. Chair.
Go ahead.
Mr. Congressman. Based on the 2019 data, we paid 58% of the total claims payment to private and 42% to government.
That is all case rates, lahat-lahat yan.
Yes, sir.
Okay, sige. 58 to 42 ang lumalabas na ratio. So mas maraming private kayong binabayaran kaysa sa public. Ang COVID testing is in the all case rating yan, di ba? COVID testing.
Mr. President, Mr. Congressman, yes po. We pay po case-based payments also in COVID.
Magkano ho ang testing ng COVID sa all case rate ng Philhealth?
Mr. President, Mr. Congressman, the testing package po natin for all services is at 3,409. For if the kits are actually donated, if the testing kits are donated, we pay 2,077. And if all the services, including the kits, are actually provided or included already in the budget of the facility, we are paying around 900 pesos only.
Pero yun, binago nyo yan. Ano ang initial na inalaw na Philhealth para sa cost ng COVID testing?
Yes po. The initial case rate or case packages for the testing, for all services being provided, it's at 8,150. For the donated kits, it's at 5,000 plus. But for the, if again, the third case, which is the donated and all the services are included in the budget, it is around 2,000 plus, sir.
So, nagbago yung rate.
Yes, sir.
Bakit nagbago yung rate? Ano nangyari at binago nyo yung rate?
Mr. President, Mr. Congressman.
Please address Mr. Chairman na lang.
Okay.
Mr. Chairman na lang kasi Mr. President is for the
Sorry,
Senate.
sir. Yeah, I'm sorry, sir. Mr. Chair, Mr. Congressman. Yes, sir. When we did the initial costing for the packages of the testing kit, again together with a third party, we only had very limited sources of data then, especially konting-konti pa lang po yung merong accredited facility. At the same time, konting-konti pa rin lang po yung merong mga testing kits available then.
Oh, then, Mr. Vargas, ilan ang binayaran nyo ng 8,000 pesos para sa COVID testing? And kanino nyo binayad yung 8,000 pesos na yun?
Mr. President, Mr. Chair, for a while.
Go ahead.
Kailan nagsimula itong nagpababago ng rates? Magkano ang binayad nyo sa 8,000 pesos sa isang COVID test?
I'd like to recognize the arrival of the President of the NUP, the Honorable PD Barsaga, who's here with us.
For the COVID, Mr. Chair, Mr. Congressman, for the COVID-19 testing kits, before the June 25, the total number of claims that we have is at around 12,000. and the total paid claims is around 2,181. And we paid around 9,863,000. For the COVID testing naman po, after the June 25, we have a total number of 38 claims so far, and still it is not paid and still on process. That is as of July 31.
Mr. Vargas, meron ba kayong time limit sa COVID test? Kasi ang COVID test is only really good for 2 days. On the third day, wala na siyang silbi kasi wala yung information, di ba? Information is the key to COVID, di ba? How long, meron ba kayong timetable na dapat ilabas ang test within a certain period of time para ito bayaran ng Philhealth?
Mr. Congressman, wala po kaming, with regard to those protocols and guidelines, it is under the DOH po. Our particular function with regard to the testing is actually for the reimbursement for the
Pero di ba, you can also put in your own policy as to the efficacy of any procedure. Meron kayong mga iba-ibang departments, di ba? Napaka-top heavy nga ng Philhealth eh. Pag sinabi niya, di ba, kung alam niyo, ano ba, sabihin natin, yung isang COVID test, 15 days walang resulta. Lumabas ang resulta on the 16th day. Ito ba, babayaran niyo pa rin ang full ito?
Yes, Mr. Chair, because the currently what we follow as a guideline kung sino po yung babayadan namin is the department order, the department memorandum of the DOH of who are going to be tested. Pero with regard po to the protocol on kung kailan lalabas yung mga resulta, kung gaano po kabilis yung resulta, hindi po kami ang nagre-regulate on that.
Mr. Chairman, I'm asking that question because it's useless for Philhealth to be paying for tests where the result comes out very late in the day because these tests have no more value. Nobody is supposed to be reimbursed for a service that never really helped the person. Sa ganitong usapin, para naman parang hindi na ho reasonable na bayad tayo ng bayad kahit na hindi na ho paso na yung test kung tutuusin eh. 2 linggo bago lumabas. Di ba ho parang wala namang hong visa rin, Mr. Chairman?
Yes. With yung dumgo sa puntos na ni-raise ni Honorable Remulla, ang pagkakalam ko, meron na po kayong 1 billion for reimbursement na submitted po sa inyo.
Mr. Chair, I think the 1 billion that was stated, I think was on the liquidation with regard to the IRM.
Yes, pero kasama dun sa IRM nung liquidation, yung COVID testing, about 300 to 400 million, if I'm not mistaken.
Yun po kasing ating Mr. Chair, yun po ating po kasing pa-process, especially ng liquidation, pagdating po sa IRM, yun po ay naka-charge dun po sa lahat ng claims na pumapasok po sa Philhealth.
All I'm saying, Mr. Vargas, is that yung binabanggit ni Honorable Remulla, isubmit nyo sa amin yung liquidation ng 1 billion, which includes actual persons, na yung mga tao na nagkasakit ng COVID, at saka yung testing. Nandun din yan.
Yes.
So can you kindly submit the liquidation ng 1 billion? Dahil yung pala nga nakikita natin sa ngayon, sa 30 billion o 30 billion, ang binigay ninyong pondo sa mga ospital ay 14 billion. Sa 14 billion, may 1 billion na na-liquidate. Yun ang para makita ni Honorable Remulla kung saan napunta yung mga yan at sinong gumamit ng mga ospital bukod dun sa nagkasakit at nagpa-testing. Honorable Barsaga?
Yes, just follow up lang for clarification. Pag nagbigay kayo ng IRM sa isang ospital na nag-treat ng COVID patients, yung IRM na binigay nyo, pwede nilang i-charge for COVID and non-COVID sickness. Just to clarify. Meaning to say, sa isang ospital, nag-treat ng COVID patient at the same time continuous ang kanilang pag-treat sa mga nanganganak, etc., they can always charge that to IRM. Tama po ba?
Mr. Chair, Mr. Congressman, opo, The IRM po,
Okay na po.
Hindi, okay na yun, okay na yun. We will discuss the IRM later on. Kinaklarify lamang natin so that yung mga kababayan natin, pati na yung healthcare institution at mga kawani nila ay hindi magkaroon ng misimpression na IRM can be charged only for COVID patients, even non-COVID patients, as long as they are confined in a healthcare institution, they can claim the Philhealth. Tama po ba? Okay, thank you.
Okay, so inulit ko po, no, ang discussion natin ngayon, papasok po tayo sa all case rate. Mamaya po, papag-usapan natin yung interim reimbursement mechanism. Kasama po dyan yung finance, na natanong na rin may katanungan rin si Honorable Remulla. Tapos yung computerization, OFW contribution, and COVID testing, kung sakasakaling babalik tayo sa tanong na yan. Honorable Remulla?
Ano na lang muna, Mr. Chairman, isa na lang, no, itong sa cataract na lang. Yung well-med controversy, Mr. Pargas, you're very well aware of that.
yes, Mr. Chair.
Magkano yun na involved doon sa well-med controversy?
Around, Mr. Chair, around 800,000.
800,000 pesos?
I'll confirm, yes. Yes,
Mr. Tiago, kayo na sumagot. Ano yung sinasabi niyo?
As far as I can recall po, ang nakita po na Mr. Chair, na ghost patients, ang na-validate po na ghost patient na walang dead na
Patay
is
na.
about 800,000. About 800,000 po.
800,000.
Apo. Yun na-validate po na patay na pero nakaka-claim.
800,000 pesos yung claim.
Apo. Total na po yun.
Total claim.
Bali, hindi ko lang po alam po ilan yung claims nito, pero yung pong na-validate na patay na, mga 10 po yata, mga 800,000.
Mga something like 40 sessions. 40 to... Ilang sessions yun?
Kailangan ko po i-verify.
160 sessions.
Less, in total po, less than 160, yes.
Well, Mr. Chairman, I will reserve my other questions for later. I would like to give back the floor to you.
Thank you, Honorable Remulla. Sige po.